What COVID has allowed us to see is this has always been a different world for different people.
Certain parts of the population being underserved while being overly overinfected and disproportionately affected by COVID-19.
Millions of COVID-19 tests have been done at sites like these across the province. Quebec community groups are calling on the provincial government and public health officials to use what they have, saying it is vital to collect race-based data.
This after a recent Statistics Canada report showed population groups identified as visible minorities or at increased risk of COVID-19 infection.
Because, as you know, race-based data are not always available in this country, either at the national level or at the provincial level. So this study provides still an incomplete but still quite revealing snapshot.
Currently, health race-based data isn't collected in Quebec or most of Canada, the government's reasoning being that it isn't required since everyone is and should be treated the same, a claim that doesn't make much sense to many community organizations who say that the information is vital in order to be able to serve everyone equally.
No, we can't collect race-based data because it's discriminatory, it's reverse discrimination, it's violation of privacy. Well, the Human Rights Tribunal just ordered that last November, so now there is no more legal reluctance to do so.
Keeping this one ideology that everybody is the same, and it's not. So even at institutions with different task force that are in play at the universities, at McGill and at Concordia, and I'm sure at the French universities, they're realizing, hey, we need this information if we're needing to serve these groups of students.
If we don't have the data, we can't prove it. And we think that this is maybe one reason why for a government that refuses to recognize systemic racism, also refuses to recognize and collect race-based data. Because without the data, we cannot prove it empirically and scientifically.
The Statistics Canada report released in March indicates that visible minorities are more at risk of contracting COVID-19, in part due to being overrepresented in professions who are unable to work from home, such as nurses' aides, orderlies, and patient service associates. Before the pandemic, 34% of essential healthcare workers identified as visible minorities, compared with 21% in all other occupations.
And I would also need to say that many of our federal and provincial employment equity legislation requires data collection based on race to measure, among the things, the underrepresentation of people of color or visible minorities and indigenous groups in different employment positions. So the concept has been pretty much in practice in the employment field. Now we have to move in the public health field and the health and social services areas in order to better document, to better serve, and to better respond to public needs.
In Montreal, Sacha Obas, City News.